So now we're going to do a recontouring of the lip. So what we want to do is create a little bit more of a lip liner so the lips look a little rolled up and look more full. Now, the most common question I hear is, I don't want to look fake, and people name a variety of stars that they do not want to look like. I can assure you that by the end of the treatment, she will not look like a porn star. She'll still very much look like herself. She has asked me to give her a little bit of lip liner so her lips are a little more pronounced and not as thin, and also have a little more of a pout. Some people who are older, what they want to do with their lips is to create a lip liner so the lipstick actually stays confined to the lip and doesn't bleed on the face. So we do actually even a more subtle correction in that case. The nice thing about Restylane is that it's a very natural product. It actually has numbing built into it, so it's not as painful. It can last about 6 months. I've seen some people last like as much as a year. And it goes on very natural, and it gets dissolved by the body very naturally because it's a volumizer, a natural product that our skin normally makes. So what I'm going to do is I'm going to start treating her, and we're going to use a little bit of ice to make it a little more comfortable for her. The most common side effects, like again with any injection, is a little bruising, and that can happen even more on the lips because they're so highly vascular. Open your mouth for me a little bit, sweetheart. A little more, perfect. Here we go. Did great. Just like that along the lip border to create just the right contour we're going for. You're doing great. Beautiful. And we mold it right into place because it's such a malleable product, and we create just the contour, and you can even see there's a slight difference between where we treated and not, but so subtle that it just looks good but not fake or overdone. Now, one area that she wants me in consultation to accentuate more for her is this Cupid's bow. She wants it to look a little more pronounced and sexy, and easily done. We can do that, and that's probably the most sensitive part of the lip to be treated. But a little trick is to go in areas we've injected before because it's a little numb, since this product already carries some numbing ingredient inside. And there you go, half of the lip treated, the other half not treated on the upper lip. Very subtle, but perfect lip. So what she also wants to do is create a little pout. We're going to go ahead and create a little pout for her. There you go, just like that. Now that we've done the upper lip, and as you can see, exactly the way she wants it, which is a little youthful and sexy, but obviously not overdone. We're just going to have to match the lower lip. And one of the most important things in doing a natural lip is to be able to keep the ratio of the upper lip and to the lower lip consistent with that person's ethnic background. If you look at someone who is African American, they have a different ratio than someone who's Caucasian. And if you ruin that ratio, then you create a more synthetic look that doesn't look natural to that person. So we're now going to go and put just the right amount on the lower lip. And she wants her smile to be wider, so we're going to create like a little bit of a wider smile. Some people want their lips just pouty. Perfect. And just like that, we can recontour the lower lip. You're doing so great. Good job. Good job. We're always trying to be careful not to hit any vessels that are in our way. So we're going to do the other side, but before we do that, she had asked for a little bit more of a pout, so we're going to put just the right amount of pout in there for her. There we go. Bring your lips together, like this. Oh, there you go. There's